Okay. I'm Olivia B, and this year in ISM, I'm studying pediatric hematology and oncology. This is basically the study of blood disorders and cancer in children. And the reason I really got into this was over the summer and last year, I started having a lot of health problems. So I spent a lot of time at the hospital, but I didn't really like what was wrong with me, so I didn't really find it interesting. But I got to see other kids that were sick. So I saw cancer kids, and I thought that would be a great way to reach out and help people because I really enjoy that. And that's what sparked my interest. My quote is, "When everything seems to be going against you, remember an airplane takes off against the wind, not with it," by Henry Ford. And this really spoke out to me because in pediatric hematology and oncology, not much is really going to go for you because there's no true cure for cancer. You can't cure every patient. You only have like a 70% chance to cure them. So no matter all the obstacles you go through, you're going to get somewhere. You're going to make them better in some way, but maybe not completely cured. And I think it also speaks to like the patients because cancer is not going for you. That's not something that's like good for you. And they just have to remember that in the end, everything's going to be mostly better. So for research, I started out by researching how to understand a patient. I thought that was really important because most people don't have cancer. And if you're treating someone and you don't know what it's like to be on their end, then how can you really connect with them and know what they need? And what I did to understand a patient was I read a survival story. And she talked about how she had it late in her senior year. And so she had it going into college. And in her college, they had like a cancer group that would meet up. And she thought it was going to be something like people who had cancer and they would go and talk about how they're going through it, how they're coping with it. But it was really just a bunch of people getting together, like mourning about their family members that they've lost. And the particular cancer that she had, no one knew about it. And so I think that people really need to be educated on all the different types of cancer, not just the ones that are most prominent like leukemia and lymphoma. And so that also ties into my original work, which I'll talk about later. And she also talked about how emotionally draining and physically draining cancer is. It's not really the cancer, but it's more of the chemotherapy and the treatments that they get, the trips to the hospital, and those kinds of things that are kind of out of their control, but they drain you and you're not yourself anymore. And so that really spoke out to me because that's one way you can connect with them, by knowing that what they're going through is a hard time and trying to be sympathetic for their end, but still be the doctor and not their friend. I also researched late effects of childhood cancer, and I thought this was interesting because the chemotherapy, it doesn't only affect you while you have the cancer, but it affects you after it as well. Since the chemotherapy isn't localized, it attacks all of your cells, even the ones that are healthy, and that's what weakens your immune system. And once you have a weakened immune system and you can't fight anything off, then you tend to get more sick. And even after the chemotherapy, your immune system hasn't fully built back up, so you're still susceptible to more diseases, and those trickle in later after your cancer is gone. One of the biggest late effects is obviously remission. And usually you will relapse and have the same cancer. Like if you had leukemia, you'll get leukemia again. Well, in this article it talked about how kids with Hodgkin's lymphoma actually tend to get leukemia afterwards. And I thought that was interesting because even though they're kind of similar, they're different in their own way. And so I thought that was different. The late effects also talked about the physical effects. Like it said that like if you had a tumor cancer, that it can impair your ability to move other parts of your body. Like you can be paralyzed in some places, and so that's something they would have to deal with the rest of their life. I also researched common childhood cancers. This was preparing me for my research and my original work, and what stuck out to me the most was that the symptoms resemble common illnesses like the flu, and that's what causes people to have late diagnosis because they don't think that they have cancer. Like, you're nauseous and you may not think you have cancer, or you like start getting like you wake up with one bruise here and another bruise there, but you're like, oh, I must have just hit myself. Well, you could actually end up having cancer, and if you don't catch it in time, that's another way to make it more fatal because you don't get the treatment you need at the right time. The protocols for different cancers are similar but different in the same way. If you have a tumor, they're usually going to take a biopsy, or they'll do a CAT scan, an MRI, and that will help them diagnose what kind it is. If they think you have like leukemia or something, they'll obviously do a blood draw and test your blood. And the treatments vary, but again are similar between radiation, surgery, and chemotherapy. They usually always use chemotherapy, but radiation and surgery is for tumors and things like that. I also researched how to help those with cancer because after researching how to relate to a patient, you understand that it doesn't only affect the patient, but it also affects the whole family. Like if you have siblings and stuff, they're affected by it too because now your whole family is mainly focused on the sick child, and so you are lacking some of your needs, maybe the rest of the family is too. And so a way that you can help them is to make meals for them because in this article it was written by parents of children with cancer, so this is kind of their perspective. They were saying mainly that the meal maker is the one that spends the most time with the child at the hospital, and so there's not time for them to necessarily make homemade meals, and they might have to eat fast food for several days, and sometimes it would just feel good to have a homemade meal. She also talked about how to help with their other children, such as like carpool if they can't drive, or like taking them to their extracurricular activities because they're spending their time at the hospital, but their other children still need to be taken care of. So for my interviews, all my interviews were conducted at UT Southwestern or Children's, and this is my interview with Dr. Victor Aquino, and he is my mentor now. He specializes in bone marrow, so more on the leukemia side, and he talked about how that the reason he chose to do pediatric hematology and oncology is they have a low burnout rate because of the higher survival rate. The chances of survival are 70% and the chances of death are 30%, whereas in adults there's a higher percentage of death. He also studies immunology, and this was interesting to me because it allows him to be able to help the patients not only with their cancer, but with the sicknesses that come with it, because he understands the way the immune system works and how the cancer affects, the chemo affects the immune system. Dr. Martha Stegner was my second interview, and she was really busy. I had to wait like 3 hours before she actually talked to me. So that kind of showed me how busy they are, and like that they don't really have time to just sit around and do other things. They're really doing their job most of the time. And she mainly talked about how you shouldn't stress out about your job, and if things aren't going right, it's okay. And she said that the biggest thing is to enjoy the time that you get with your patients because they're not going to be with you all the time. And she also said that she preferred kids with a serious illness, and I agreed with her on that because she liked it because she gets to see the patients more often, and you have a bigger impact on them if they have a serious illness. You see them more often, your treatments are more effective usually, and you get to see them go from really sick to back to being healthy again, And I liked that idea, and that kind of like sparked an interest in wanting to do ones with maybe rarer cancers or the serious ones. The next person I interviewed was Dr. Andrew Coe, and he introduced me to lab. I had really never thought about doing lab, but I kind of got from him that I might want to do lab. He used to do clinic, so he knew the differences between them and how to like use something that he knew from clinic and incorporate it with his lab work, and that was kind of cool. And he talked about how that kids are more resilient because they're kind of like, they're new, they're fresh, they're healthy, their organs have less wear, and they haven't been drinking their whole life, smoking, and so they're healthy and they're ready to fight. So that's why the chemo usually works better, because it doesn't necessarily tear them completely down whereas it does for adults. And he said to ask what motivates you, and that kind of really spoke to me, because he was talking about, does emotion or does intellectual motivate you? And that was kind of hard for me to answer, because although I love to be with people and I want to help the patients, I really strive to learn more, and I have an intellectual desire, and that made me want to maybe do lab. And I was thinking that you can still help the patients in the lab, like you're still helping them because you're coming up with the treatments and stuff, but you don't get to see them, and you don't have to get to have that patient-doctor interaction that most people really want when they go into the medical field. So that would be something that I would miss if I would do that. The characteristics that he described to be a pediatric hematologist and oncologist are, you need to be focused and stubborn. And those kind of describe me. Well, I'm like focused as stubborn, not as much, but focused, I'm really focused, and you need to be focused so that you can get your work done. He was talking about how you just can't come to work and just sit around for a little bit. Like, you have to go in, know what you're going to get done that day, and execute it and get done and get out. And he said the reason you need to be stubborn is because things are not going to go your way all the time, and if you think that that's the right answer and that's the way you need to be going, then you need to stick with your guns and go that way. And that spoke to me. The next person I interviewed was Dr. Patrick Levy, and he was interesting. He was from Ireland, and so he had gone to medical school in Ireland, and he went to school for 18 years because the medical school in Ireland does not qualify as a medical school in America. So he was very, very educated. He talked about the main difficulty was frustration of not being able to cure a patient. Since in kids you have a high survival rate, when you see one that you really can't cure, it tends to be harder to accept. And so he really talked about that. He also said that his favorite thing to do is to walk into a room and just immerse yourself in the family's life, to understand what they're going through and to really help them and show them that you understand and you're here to help them, and you'll do anything to make their children better. He talked about the treatments such as radiation, chemotherapy, or surgery, and that they were used for different cancers, but chemo was really used for all of them. And he also talked about clinical trials. And clinical trials, he said, is one of the reasons that children survive more than adults, because they take groups of children with the same cancer and they give them the same medicine, the same treatment, the same rounds. So they see what doesn't work and what does work. And with each clinical trial, they make a difference and they improve. So each time they have a different one, it's better and it's stronger and it works more efficiently, and that's why they tend to survive more as well. The next person I interviewed was Dr. James Amatruda. He did both lab and clinic, which is very rare for a pediatric hematologist and oncologist. It's hard. They said it was very hard to balance your time, and usually people did tend to go to lab after doing clinic, which was different for me to hear because I would see people staying with clinic. But what he enjoyed about being in clinic and lab at the same time was he could see the problems in the lab and take them to the clinic and figure out different ways that he could solve them. and vice versa, taking problems from the clinic and going to the lab and saying, like, this is what's wrong in the clinic and we need to fix it with some medicine, figure out how to do it, and go from there. And I thought that was cool because it's like problem solving. It's like translational. What he talked about that was really hard for me to hear was that you can't always treat every child. He said that the child's life is out of your control. He said he's had kids walk in and they've come from the ER saying that they think they have cancer, and they send them up and their parents are not very involved in their life, or there's a lot of drug use in the house, or they're poor, and you can't do anything about that. You can't change the way the child's life is, but all you can do is hope that you can help them. And that was hard for me to hear because I feel like everyone should be able to be helped even if their life isn't perfect. He also talked about how he has tried to do target therapy, but it was very hard. You can't really send the chemo to one area. It goes through your bloodstreams and the other cells pick it up. And so I thought that would be cool if he could figure out how to do target therapy, because there would probably be more survival rates. And one of his clinical trials is actually being in the process of being used. So I thought that was cool too, because it takes a lot of money and time to come up with a clinical trial. He talked about how they want to have DNA diagnosis for like all of their cancers and not just some, to figure out which mutations show for which cancer. The last person I interviewed was Dr. Andrew Martin, and he was new, so he had really just finished his fellowship and his residency, and he didn't really have that much to say to me. So that was kind of like disappointing, but it was good at the same time because I kind of got to see what it was like to be new in a practice. He basically told me that they have changed it to they have to be recertified every 7 years in pediatric hematology and oncology and regular pediatrics. They have to show that they've been doing more research in their field, and so that they can show that they're improving. He also said that even though he just started, that he's never off work. The hours are said to be 8 to 5, but they're not. You come home and you might take a break to eat dinner or hang out with your family, but then you're back working, trying to figure out ways to cure the kids or write in their charts and figure out what your next day is going to be. And I really just kind of got to see this because my mentor, I emailed him a week ago, and he just emailed me back at 10:38 p.m. So I really saw that they really are doing their work all the time. They don't have downtime that much. He also talked about how the chemo brings low blood count and more infections, and this seemed to be something that all of them really did talk about, so it seems to be a very big focus in this field. And he also talked about how clinic is translational. They're taking the things from the lab and putting them into the clinic. And down there it shows the phases of clinical trials. So what I really learned from my interviews were that kids are more resilient, and the reason is because their epithelial layers and their organs have not been torn down by smoking, drinking, drugs, or just living and being old. And so that was kind of neat to hear that the kids do have a better chance to survive. And another thing I learned was that chemo brings a lot more problems. It doesn't only help the cancer, but it hurts the organs and causes other things that can be worse. I also learned that chemo kills the DNA, so that's not beneficial. And I also learned that it's a long process. It's a long process to cure a kid, and it's a long process to even become a pediatric hematologist and oncologist. And they told me that I need to have patience, dedication, passion, and ambition to do my work. I also learned that they never stop working. They're always working, and although it may be different, they're still working, and that doesn't change. They work all the time. So that was kind of alarming to hear. They're never off work. So for my original work, I really want to educate myself about all the different types of cancer, because I know I don't know all the cancers, and I know most people really don't know every childhood cancer or the most common childhood cancers. And so what I want to do is I want to create a chart that has the most common cancers, which are shown in that pie chart right there, and how common they are. And you can see mainly leukemia and lymphoma are the most common cancers. And then in the chart, I'm going to have like a description of the cancer, the symptoms that you should look for if you think your child might have cancer, also resources like support groups, things like that, so that when people get new diagnosis, they can, like if it's at the doctor's office, they can see that chart and they can see where their next steps lie, like maybe the different clinical trials they could do, or the support groups, or which hospital is like the best, because some hospitals are more specialized in like brain tumors, or they have like better brain tumor center than another hospital. So I think that would be really beneficial for everyone.